excited to be here with you today to talk about community-led development and what Catholic Relief Services is trying to do with a couple different approaches we have to really deepen and strengthen our work in community-led development. And I want to talk in particular about two approaches we have. One is an approach called the Integral Human Development Approach. And the Integral Human Development Approach really focuses on the individual as a member of a family, a community, and a society. The Integral Human Development Approach demands that we work with indigenous institutions. So I'm trying to avoid the word local because we seem to have a lot of confusion about the word local. What does it actually mean? So I'm going to use the word indigenous rather purposefully to imply those institutions which are from the nation in which we are working. And they could be organizations that are community-based, from the nonprofit sector, from the government, or from the private sector. So in our Integral Human Development Approach, we work with those indigenous institutions to create the conditions that allow all people to live lives of dignity, to live in a peaceful and just society, and that they're able to secure well-being for themselves and their families and communities. As John mentioned, it's bolstered by the Catholic social teaching principle of subsidiarity. And you can still go to Wikipedia, but the principle says that decisions should be made by those people that are most affected by the situation at hand. So it could be the individual, the family, the community, or the nation themselves, that they have the right and the responsibility to make those decisions, and that those decisions should not be unduly influenced by a quote-unquote higher level of authority. Even if that external factor is a cherished partner from an international NGO, right? So the IHD has, or the Integral Human Development Framework and Approach has 6 factors. And you'll notice throughout this slide it says we, and I want to really reinforce the notion that we in this case does not mean Catholic Relief Services. It sometimes means we with an indigenous institution. Sometimes it means a collection of indigenous institutions. Sometimes it's the government and private sector and an international donor. But it's this idea that together, based profoundly in local institutions, in those indigenous institutions that comprise the society in which they work, that they are working together with people at the community level to help do an analysis of the strengths and the assets that they have. It's fundamentally a positive approach that says every community, no matter how beleaguered, has strengths and assets, but that they also face risks and shocks and traumas to their livelihoods. And it helps that community do an analysis of what do we bring and what are we facing. It further then asks the community to analyze what are the systems and structures that are in place to either support us to make our lives better and to enhance development in our community, or that are creating unjust conditions that keep us in poverty, keep us in living in conditions of injustice. From there, it's a question of looking at the strategies that are in place or creating new strategies to help communities respond to those challenges they're facing. So the integral human development is essential to our theory of change in CRS, and this idea that if we work collaboratively with those indigenous institutions at all levels of society, from the community-based, the civil society sector, the private sector, the public sector, and if we work at multiple levels within society, from individuals to families to institutions, national and on that up, then we can help people realize their essential integral human development. And we do that through a variety of means. We do it by strengthening the capacity of those indigenous institutions in the way that they see their future and the way they see their missions to go forward. We encourage work based on evidence-based approaches and the use of data so that we are not experimenting on the lives of the poor unduly, that we are thinking about how we are doing this, and we are helping our partners to think through the strategies they're using. That we encourage and foster strong relationships amongst different parts of society and across those different sectors in society to do this work. And really fundamentally, we are working in this framework to say what are the conditions, the systems and structures that are keeping people in poverty and in conditions of injustice, and what can community members do to address those while they're looking at their fundamental needs. So the other approach that I think is essential to our work in community-based development is our partnership approach. And CRS has been in existence for about 75 years. How we've worked in partnership has certainly changed over the decades, but it is fundamental to how we understand change taking place in the world. That by working with, sustaining, and strengthening Indigenous institutions, we are in fact enhancing a community's ability to respond to its own problems. That real sustainable change comes about when individuals, families, and communities are supported by the institutions in their society to make that change. And that having a healthy balance of us, and quite honestly, we are the most concern for us is civil society, but we are concerned that a healthy, vibrant civil society is a partner with government. There are droughts in many parts of the country and flooding in others. The resulting climate change has created a condition of real food insecurity, an increase in malnutrition, and a lot of instability in communities. So for a number of years, we've been working with a coalition of the very types of community groups that were discussed earlier: water associations, women's groups, farmer associations, the Ministry of Agriculture, an agricultural research institution, a variety of Burkina Faso institutions that are working directly at the community level to help, as it says here, to look at how can farmers and people in the community analyze their assets, look at the risks they're facing, and come up with strategies to improve the amount of food they're able to produce and sell, the kinds of healthy foods they're eating to address the malnutrition issue, to look at what they can do to recover this land that's been so affected particularly by drought. So better seed systems, soil conservation, water conservation, and to look at how those groups can play an active role in promoting these improved practices. And I really appreciated one thing you said about the sustainability of these groups, because this is a concern, particularly at the community-based organization level. And I think one of the approaches in Burkina Faso and elsewhere has been to say, how can we not only transfer those skills, but talk about how you use those skills in a variety of settings and in a variety of ways, so that the institution may sustain, but the investment people will be sustained. I think there's a different approach to working with the nonprofit or the non-governmental institutions in the country, where you really can work for organizational sustainability. But at the community level, it's a matter of increasing that competence and increasing that thinking about how you can apply those skills elsewhere. So I wanted to talk about Malawi. It's interesting, Malawi and Burkina Faso are very different environments, very different cultures. Everything about them is different, but Malawi faces some of the same challenges that Burkina faces. They have periodic droughts, they have periodic flooding. It's compounded in Malawi by some economic challenges, some political challenges, and a much higher rate of HIV that leaves many children in situations of extreme vulnerability. So for about 8 years, we worked with about 230,000 families. Not for 8 years. For about 5 years, we worked with about 230,000 families in 8 districts of Malawi, with a variety of partners from the local Catholic Church, the Ministry of Ag, Ministry of Health, again, water committees, women's committees. We also worked with seed companies and agricultural buyers who are not just seen as tools in the project, but were actual full partners in helping to analyze the situation facing farmers and helping to find strategies and solutions in order to, again, improve the quality of the land, improve the quality of agricultural production for both sale and home consumption, to really look at the case of vulnerable children and see what the communities themselves suggest for strategies to help those children living in those vulnerable conditions, and to look at how to support, despite the shocks and cycles they face, more support, particularly to the most vulnerable in society. So I'm going to take 15 more seconds to say my final thing. And I think this conversation is really imperative. It's easy to talk about multi-sectoral approaches, but I do think fundamentally we have to change who we are and how we operate. The world is not the same as it was when CRS was founded in 1943 or when the World Bank was founded in 1943. It is fundamentally different. Nations now have vibrant economies, world-class university systems, complex political situations. They are entire nations that didn't even exist back when we were founded. But they also face serious challenges: terrorism, climate change, terrible adjustments in the world economy. But the reality is that people have the right to lead their own development. And they not only have the right, but they are increasingly saying that they want to lead their own development, and that is no longer our role or the role of any donor to use any sort of means, financial or other, to convince people that our way is right. And if we don't transform how we do our work, if we are not profoundly based in working with those nations and those institutions to help them get where they want, I don't think we'll survive as an industry. Fundamentally, we all have the responsibility to take care of our own nations, but we also have a responsibility to one another. So I believe there's still a role for us, but we need to approach that carefully.